3 surgeries on my heart.
Levi is 4 years old. He was born with a severe congenital heart defect, transposition of the great arteries, a ventricular septal defect, and pulmonary atresia. We found out about his condition at our 18-week ultrasound when I was pregnant. When he had to have surgery at 6 days old, we were terrified for him, and of course terrified that something could go wrong during the surgery.
I was born with a hole in my heart, a VSD or ventricular septal defect, and it's a hole between the lower chambers of the heart. I had my first surgery here at Cook Children's at 11 months of age. There were some complications, and I did spend some time here. As a kid, I always thought I was different. My mom always told me that I was different, but I was special. She always told me I had a special heart.
She was born with a very common defect that has a very good prognosis, but it highlights the importance of lifelong care. Lifelong care for the pediatric patient with congenital heart disease is important because there are some long-standing issues that can occur even with a very good repair.
I do have some side effects. I have rhythm problems. I've had those since my second surgery. I also have problems whenever I'm pregnant.
Having Crystal involved in our program is very exciting for me and for the rest of our staff here, because it gives us the sense that we're doing something for children that will be a lasting promise to them, that they will be able to thrive with their congenital heart defect.
I feel that the bond that I share with Levi and with other patients is created by my unique perspective of having also been born with a congenital heart defect, of also having undergone open heart surgery. What I love about Levi is his smile. That's the best thing. That smile it lets you know how he's doing, how he's feeling, if he's having a good day, if he's having a bad day.
It is a relief to know Crystal and know an adult who's thriving and doing fantastic with a family of her own. It's great to know her and to be able to see how well she's doing. He loves to be a different character each day, and he absolutely insists that we call him by that name for the entire day. He calls it a tiger scratch, and we don't know where he heard that. We never told him that's what it was called.
Tiger scratch.
Looking back at pictures of Levi when he was a baby and a really young toddler is amazing, because I don't think at the time we realized how sick he was and how fragile he was.
The research that's been done on congenital heart disease has been tremendous, but there's much more work to be done. Through organizations like the American Heart Association, we've been able to identify issues with adults as they grow up with their congenital heart defects. Identifying genes that are instrumental in causing the congenital heart defects at baseline have become an important focus of research.
I'm doing what I believe I was destined to do, what I absolutely love, and that's working with children who have heart defects, who were born with heart problems just like I was.
His life is absolutely normal, like any other 4-year-old, just with a few more checkups and tests during the year. When I think about his future, I don't think there's anything that he will not be able to do. I think he'll be able to do anything and everything he wants to.